Hello, my name is Ivana Uwade, and I'm the creator of the Facebook group JK Lifestyle and Travel. Today, we're meeting with Dr. Thomas Kouo. He's the Dean of the Eastern School of Acupuncture and Traditional Medicine. Hi, how are you today?
I'm fine, Yvonne. How are you doing?
I'm fine. So, what can you tell me about yourself?
Well, I don't know if there's that much to tell, but I've been in the acupuncture field actually for about a little bit over 20 years or so, or a little less than 20 years, and the I've been working as as you said, the dean of the Eastern School of Acupuncture and Traditional Medicine, kind of concentrating more on bringing the next generation of students into the field, and the promotion of our medicine, which I think it really serves as a great adjunct to the wonderful field of secular medicine that we have right already. I think it's important that we have multiple perspectives, multiple approaches, because the health of people and people's physiology is so complex that they're really to take one approach to the maintenance and the improving of illness for people is really limiting. So I think it is really incumbent upon all of us that have different perspectives, really to bring that to the table and use that for helping people to improve their lives.
I just want to say, I read your bio. You have an extensive background working with this field, so you're being modest, but that's good. It's always good for a person to be humble, but I just want to point that out to people. Could you tell me,
Thank you.
What is acupuncture?
Well, acupuncture really is, so acupuncture itself, there's a couple definitions and a couple ways that you can look at. Acupuncture is literally a tool that the acupuncture medicine profession utilizes to treat disorders of the body. So acupuncture, essentially, if you want to break it down, is taking needles, very thin needles, about the width of a hair, inserting them into specific places on the body that are pre-mapped, safe, because we study the anatomy, know where these things are going. We know how deep they can or should go for the proper physiological response when they're adding it. But I think more from a global perspective, the idea of acupuncture is a profession. Acupuncture is a profession and a system of medicine that encompasses more than just sticking needles in people. It encompasses that, and we learn all about that. But what surrounds that is a system of medicine, a system of thought, a philosophy on the way of life and the way that the body exists, how it stays healthy and how it becomes diseased, that informs how these kind of practices or the practice of the acupuncture tool should be utilized in health maintenance. So again, two different ways of looking at it. From a kind of myopic way, it's sticking needles in people. But from a more global perspective, the idea or the brand name of acupuncture has come to mean a great deal more. It's come to represent this profession, which is essentially a different medical practice. And so acupuncture now is the title of this entire different system of medicine. We have what we call Western medicine. We call it Western medicine because we also have Eastern medicine, right? So basically medicine defined by geographical location. But what we know today as allopathic medicine, or what we call Western medicine, versus the medicine that comes from the East, which is not just acupuncture medicine, but also things like Ayurveda and other things that more from like India and things like that, will all be under that kind of Eastern medicine type of umbrella. But so acupuncture, but if you want to keep it simple, acupuncture sticking needles in people. But again, of course, in a very systematic, safe, and therapeutic way.
Okay. Does it involve mental thought? What I mean is, are you identifying how the mental affects the physical? Is that part of the acupuncture study, or does it come under that umbrella?
Yeah, so Yvonne, that's a great question. So one of the real hallmark signs of Eastern philosophy, which of course medicine comes from the culture in which it derives, right? So is that Eastern philosophical thought is that there is a continuance, or there's a body, mind, spirit paradigm in which they cannot be separated. So they presuppose that the human person are several aspects all in one. For example, we don't, even in modern scientific Western thought, we wouldn't say that just a body that's sitting there devoid of life is alive, because it's literally a body. The spirit has left and the person has deceased. Then we wouldn't say, well, that person's alive because look, I'm touching their body. They're there. And so one of the basic tenets of I think life, and so when we look at medicine, it always has to revolve around what is the definition of life, and then of course quality of life, and so that body, mind, spirit paradigm, that basic trinity there, in Eastern thought or Eastern medicine, has the idea that they are inseparable. So that you can treat the body, but it is inevitable that if you treat the body, that you will affect the mind, or you can treat the mind, right? If we were going to take modern psychiatry or psychology and look at that talk therapy works. Why? Well, because we can, through speaking and through hearing, we can affect one's emotional life, thereby changing chemicals in the brain, serotonin, norepinephrine, these kind of things that again will change the body's physiology, right? So all of these things are connected. So Western medicine, although doesn't necessarily stress these things, absolutely acknowledges the same paradigm that body, mind, and spirit are together. The thing about it is that the same way with acupuncture, actually, in that because of the ways that we treat, because we mostly concentrate on one thing or the other, that we sort of forget that all three are inevitably entwined in any kind of health condition. Anytime we consider anything health, no matter what system of medicine it is, I can't think of any system of medicine that just says only body or only mind or only spirit. So absolutely, acupuncture, even though it's a physical medicine, you're utilizing a tool that punctures the body, is going to have a physiological response that is going to affect mood, is going to affect one's psyche, is going to want to affect one's feeling of well-being and their perspective on things, on who they are and what is surrounding them. So absolutely, acupuncture cannot not affect the mind, the spirit, the mood, all of those things. So yeah, good question.
What kind of conditions would acupuncture be used to enlighten or affect?
Okay.
For instance, if you have some type of illness or some type of disorder, disease, whatever,
Mm-hmm.
how could you use acupuncture to cure it or make it better?
Yeah, that's a great question. Also, and what I usually tell my patients is this when they come in and they ask me that question, which is, again, a lot of people, because they're wondering, like, what we've heard that acupuncture, the most famous thing, of course, acupuncture these days is pain, right? So we sort of hear that acupuncture is very, very good for pain, which it is. But what people don't know much more, and it's because of that body, mind, spirit paradigm that we just talked about, that if we can affect different things to occur in the body, then essentially we can change what happens in the internal environment. So usually what I tell my patients is that if you need to go to the emergency room, like you have to, you have some emergency that you need to 911, then you better 911. Don't come see me, right? But anything else, you can come see an acupuncturist for. Now, that does not mean that an acupuncturist is going to be the best person for you, because that's not true. Nor is it true for any kind of medicine that one kind of medicine is the best for all things. That just, that's a pipe dream. But certainly, acupuncture can make positive effects, some very profound, some not as profound, but can certainly be a good adjunctive therapy for basically anything but emergency situations. So you name it. If you want to talk about mental disease, if you want to talk about gynecological issues, you want to talk about pediatric issues, neurological issues, again, you name it, pretty much acupuncture and acupuncture medicine. So again, not just the sticking needles in people, but the entirety of this system of medicine can have positive effects, and some very, very positive effects.
Okay, say for instance, someone's suffering from depression and anxiety.
Mhm.
How would you treat that? What part of the body would you apply the needles to?
So that's a trick question. So that's a good question. Something like depression, anxiety is something, especially now during COVID. We have a lot of it, especially anxiety, right?
Mhm,
Which ultimately is going to lead to a lot of depression.
mhm.
Um, and and again, today is October 26th. So we'll see how it goes in a couple of weeks. You know how the country's feeling. But certainly the issue with that is the way that Eastern medicine works is that Eastern medicine so much, and I guess every medicine really depends on diagnosis. Because every treatment that you has to fit what you are diagnosed with, and the Eastern diagnosis is a little bit different in the Western diagnosis. In that Western diagnosis is there to kind of go in and look to find the one problem. There it is, bang, we got you, and then we label that a specific disease, diabetes, hypertension, da 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 da. And whereas in Eastern medicine, instead of kind of looking at it myopically, I don't mean that in a negative way, and finding that one thing that we say, that's the problem, and here's your treatment. Your treatment is in this bottle, and that bottle will be for me. It'll be for you. It'll be for NFL player that's 400 pounds. So we have to think, but an NFL player that's 400 pounds, our physiologies are extremely different, right? First of all, man, woman, very, very different. And then myself, although I've gained weight in COVID, I haven't gained that much. We have 400-pound NFL player. Again, our physiologies are very, very different, right?
Yes.
And so we have to think, well, in Eastern medicine, what happens is that instead of looking at just a specific disease and saying, okay, you are diabetes, I am diabetes, they're diabetes, and therefore here's the, perhaps dosage might be slightly different depending on, age, weight, and so forth. But generally speaking, fairly similar. Instead of looking at that, Eastern medicine looks at the cause of disease, and we call it a pattern. And we say, so we do recognize that there are diseases. Here's a disease, but your diabetes is caused by this. My diabetes is caused by that. That person's diabetes are caused by that, because we recognize that within the body, even if you look at it from a Western physiological standpoint, so many different mechanisms in the body can go wrong that will lead to the same way that it looks. Right? We look ill in this way. We call it a disease. And that person looks that, I look that way, that other person, and we all look the same. We all have the same label. The problem is that things went differently wrong in my body as they went wrong in that person's body and that person, even though the manifestation, even though the disease is the same. Now, if we just want to suppress the symptoms of that disease, then that's fine. Then we have the bottle. That is going to work. But if we want to actually correct the mechanism of why that person is diseased, then we have to recognize that my disease is different than that person's disease, even though it has the same label. And so I think one of the advantages that acupuncture medicine has to Western medicine is that particular approach, is that if we are looking for a long-term causative curative, effect on that versus just suppression of symptoms, which is important, then we have to recognize the cause. We have to recognize the specific mechanism. That's not to say that Western medicine doesn't do that, but in a general perspective, generally they don't. Generally, we're looking at a treatment of the symptoms of a particular disease, right? And so that can, again, perpetuate long-term care, but of course, quality of life goes up. So we're not looking at it as a negative. This is a very good thing. But if we want to remove the actual disease, we actually have to look at that specific cause, because that's what has to be repaired.
What method would you use to do that?
So we have several methods that we utilize to actually diagnose. One of the most important things that we do is we take the pulse. Now we take the pulse here, we call it Kouo pulse, which means a fancy word for wrist. And that's where the Western medical people, your nurse will come in and take your pulse as well. Now, what they do with the pulse is very different than what we do with the pulse. So they're looking more at like how many beats per minute and the heart rate. We are looking at specific qualities of pulse. So we learn 28 pulse qualities. And we have different positions. So we have 3 fingers that line up against basically we're looking at the radial artery here, the the radial artery here, and they are, and when we feel that, we are looking at not just how fast it is, not just how strong or weak it is, but we're looking at a whole many things in, we have 3 fingers here, and you can press very lightly, you can press kind of a medium, and you can press all the way almost down to the bone, right? So we have many different positions at which we feel to be able to understand the flow of the circulation of what we call the blood and the chi that flow within the meridians that can be felt in these positions. And so when we look at each of those positions, it tells us something about when the circulation passes through that, it's affected by that part of the body. And so we can tell by the way that the blood is flowing in those positions, how it has been affected by that part of the body. And then we can look at it and try to create kind of a picture of what's happening internally to that person. And from that picture, not just the pulse, but also we look at the tongue. Interesting enough, Western medicine also has recently started to talk about the fact that there's a topographical map on the tongue that does represent the interior of the body organs, which is kind of funny because, again, Chinese medicine has been doing this for thousands of years. So it has somewhat kind of a validated type of thing. And so we look at the tongue, we look at things like the size of the tongue, the coat of the tongue, the wetness of the tongue, the shape of the tongue, color of the tongue. All these kinds of things give us a certain amount of information that we cross-reference with what we get from the pulse. The questions we ask, we have inquiry as well. So we'll sit just like a Western medical doctor. We'll sit with you, say, Yvonne, okay, tell me what's happening, and we'll ask you questions related to what you're telling us. We will record those things. We have what we call the 10 questions, which are kind of a standardized questions about one's health. So it's basically review of systems, which is the same thing like a Western medical nurse will do when they come in and kind of talk to you at the beginning prior to the doctor coming in. And some people are going to look at and palpate the abdomen. They're going to look at the face, because facial, the certain things about facial color, certain the quality of the skin, which again, we're not talking about, we wear makeup that will cover some certain things, but we're looking at things that don't necessarily get changed through things like, makeup or eyeglasses or anything like that. So all these things put together give us kind of a picture to be able to create that idea, what we call a pattern of disharmony or causation of the disease that allows us to come up with a treatment that is really suited towards you and not just, okay, the disease, right? Here's I have a bottle of insulin for diabetes. But the insulin is not for Yvonne, it's for the diabetes, right? Whereas in Chinese medicine, the treatment that we would be giving would be a treatment actually for you, and not by virtue of the pattern that you have and then the specifics of your specific version of that pattern. We would gear to, because again, if you go to an acupuncturist, you're not going to get one needle generally, right? I mean, you can have the people that are trying to show the efficacy of one needle to do that, but that's not typical treatment. So you get more than one needle. We say, well, why am I getting so many needles? I don't like needles or whatever it is. Well, because of the specificity of your particular condition, we have to add certain things for you that we might not add for somebody else. We would probably have the core points that are related to either that disease or that pattern of that particular disease. But then your specific treatment will be your specific treatment. So it's not just these protocols, just so we do this for everybody, but it's really about treating the individual person. So it's a little bit, it's a different approach, for sure.
Well, I'm glad you could join me today. I found it very interesting, and I know I'm going to be turning to you for in the future, because this subject cannot just be covered in 15 minutes or so.
Definitely not.
I'm just glad that you came.
Thank you. There's a really rich history of this medicine. I mean, this medicine has gone, if you look at it, because, essentially it comes from Asia. But it's not an Asian medicine as in a sense as we have it today. So if you come to see me or you come to our school and you get acupuncture, that the system of medicine that we have now called TCM, which is called traditional Chinese medicine, kind of ironically, is a system or a form of the classical medicine that really developed in the 1950s. So it is, in a sense, it is an integrated medical version of the classical medicine. So it's not like this. So although there's thousands of years of history, it is a modern take on, it's almost, we could say, a westernized take on the classical medicine. So essentially it is a medicine that blends Eastern and Western, some would say the best of Eastern and best of Western medicine into one to bring here to the United States. Now, there's a lot of people that are going to favor and practice sort of the more classical styles, which means that it really kind of lets go of that Western mid 20th century influence and kind of goes back historically to the medicine as it was, as it probably was intended to be, or not probably, but was intended to be. And then you'll have the people who have, again, kind of follow that system that integrates sort of the Eastern and Western medical mind, as well as the approach and understanding of the body. So there's many different styles, and the history of it is actually quite interesting. If you really go back and looking at acupuncture in itself, to see that its history in China is rich and I would say complicated. So the fact is that we here in the West have, we've benefited a lot by not having to deal with that kind of complicated history that it has over in Asia. And we've just been able to kind of take it for the best parts of what it is, and let go of all the things that have historically perhaps held it back. So it's again, like you said, a long discussion, but a really important one for people who are looking to utilize this method to improve their lives, improve their health, and to kind of truly understand what they're doing and why it works and how it works, because that's really important to really be able to know what is happening and to really believe in what you're doing. So yeah, so thank you. I appreciate the opportunity to be able to kind of talk about this, and maybe I've left more questions than answers, but that's usually the case. So
You're the Dean of Eastern School of Acupuncture and Traditional Medicine, and you're located in Bloomfield, New Jersey. Do you have a website?
We do. It is www.esatm, so ESATM as in Eastern School of Acupuncture Traditional Medicine, esatm.edu. So, for our college.
Okay, you have a program there. How long would a person have to study to become an acupuncturist?
So there's a couple different degrees that you can have currently. Now, our field is actually moving into the doctoral level degree. So we're having an entry-level doctorate, which is essentially like an MD. You go to MD program. By the time you're out of your MD program, you're a doctor, and then you go into your fellowship, your internship and fellowship, and so forth. We are moving towards that. A lot of our schools have already integrated the new doctorates, but we also have the entry level currently is the master's degree. So we have a master's degree. Both the master's degree programs and the entry-level doctorates are about three years long. Now that's for the acupuncture only. Now, if you want to also study Chinese herbal medicine, which is really the pharmacological aspect of Chinese medicine, or acupuncture medicine, then that probably will add another year. So a little less than 4 years is about the time that you would have that kind of combined school. So most people that have had master's degrees are going to be like, what? That's the longest master's degree I ever heard in my life. And you're right. The thing about that is that when you're looking at learning a system of medicine, you have to start from the beginning. You have to start from, especially when you're looking at understanding the roots of the culture that it comes from, understanding the physiology, which is its own specific physiology described in its own way, and then kind of building from all those philosophical concepts. Again, think about Western medicine, why you can do that we won't say that medical doctors have any kind of abbreviated education, because they certainly don't. But when we look at Western sciences, Western medicine is based on those sciences, so they already have that kind of build up to their educational programs, where ours has to basically start at the beginning. And so about 3 years. If you're in an accredited institution, then it's standardized. You always have to go to an accredited institution, otherwise you cannot get a license to practice. It's, again, a medical degree, so anybody who's an acupuncturist has to be licensed to be able to perform this medicine. And that medicine, that state by state, but I know in New Jersey, we are required to have 2,500 hours of education minimum. Our program is 2,700 hours. And then our doctoral program, we haven't implemented it yet, but when it comes, it'll be a little bit more, just slightly more than that. So again, about 3 years plus, for that degree. So it's not a weekend seminar, but it's well worth it. And I think students really come out changed in the way that they see the world, the way that they're able to interact with the world. And certainly, with the kind of renewed vigor to go out there and really make a difference, and now during pandemic like this is absolutely the time that we are seeing our graduates just understand wholly why they did this, and really get out there and try to help, because boy, we can use all the help we can get right now. So anyway.
Well, thank you. Thank you, Dr. Kouo.
Thank you very much. Thank you. I appreciate having me on, and I enjoyed it very much. Thank you.
I enjoyed it too, and I learned a lot too.
All right.
But you'll hear from me again.
All right. Very good.
Okay. Thank you.
Okay. You have a good one.
Okay. Bye-bye.
Bye-bye.